Here we go. Thank you for joining us today. My name is Janik Goriev, and I'm the Health Information Specialist with Brain Tumor Foundation of Canada. We are very excited to offer our 7th webinar of the 2013 Healthcare Professional Webinar Series with Dr. Sharon Guger. Before I introduce Dr. Guger, I would like to get an idea of who is online with us today. So I'm going to launch a couple of questions here. If you could choose one for me, who is currently online with us for this webinar? Are you a healthcare professional, a patient or survivor, a family member or friend, or other? We'll give you just a moment to answer that poll. And it looks like that 93% are healthcare professionals, Dr. Guger, and we have 7% that are saying they're other. The next question we'd like to ask is, for the healthcare professionals on the webinar, are you a physician? Are you a nurse? Do you work in social work or psychology? Are you an occupational therapist, physiotherapist, or speech-language pathologist, or an other allied healthcare professional? We'll give everybody a moment to answer that question. And it looks like we have 6% are physicians, 35% are in nursing, 35% are social worker or in psychology. We have 18% OT/PT and speech-language pathologists, and 6% other allied healthcare professionals. We have a really great representation here. And one last question. Give me one moment here. Sorry. From where in Canada are you tuning in from? BC and Alberta, Saskatchewan, Manitoba, Ontario, Quebec, or the Maritimes? And it looks like 47% are from the West Coast, and we have about 33% in Ontario and Quebec, and 20% from the Maritimes, Dr. Guger. So we don't have anybody in from Saskatchewan or Manitoba right now. And one last question. Are you currently working, or do you currently work with brain tumor survivors who are in transition? Yes, no, or you're not sure? And we have 91%, Dr. Guger, who are currently working with brain tumor survivors who are in transition. Okay, so let's get started. I'm going to introduce Dr. Sharon Guger. She is a pediatric neuropsychologist working in the Oncology Aftercare Program at the Hospital for Sick Children. She completed her clinical training at Sick Kids and has been working with survivors of pediatric brain tumors for over a decade. The Sick Kids Aftercare Program provides follow-up care to meet the unique healthcare needs of childhood cancer survivors. The goal is to protect health and promote quality of life through ongoing monitoring and treatment for potential medical, learning, and emotional or social problems. Dr. Guger's research interests include neuro-cognitive and socio-emotional late effects of pediatric brain tumors and the promotion of transition from pediatric to adult healthcare settings. Dr. Guger's presentation is entitled, Where Do I Fit In? Transition Issues Facing Survivors of Pediatric Brain Tumors. I'd like to welcome Dr. Guger, and I'm going to turn it over to you.
Great. Thank you very much, everyone, for joining us today, and also to the Brain Tumor Foundation of Canada and the NIC for organizing this. I think the opportunity to be able to speak across the country using this kind of technology is incredibly valuable, and the fact that we do have such broad representation with respect to disciplines, with respect to geography, as well as an ongoing interest in promoting transition across the lifespan, I think speaks to where we are at as healthcare professionals and families moving forward. Oops, excuse me. So really the hope today in our webinar is to cover off these 3 areas in some detail. The reality of the multiple transitions that survivors experience, what exactly is healthcare transition, and the idea of the different types of cultures of care, the barriers, the benefits, and some of the models that are now being considered to really try and optimize and support survivors moving forward. And then thinking about what that means beyond the healthcare in terms of the reality of life beyond secondary school. So I don't need to spend time on this slide. I think everyone really appreciates that this is an ongoing opportunity for individuals who've been diagnosed with brain tumors who, while this is across a variety of CNS diseases. The reality is that individuals are surviving. More and more individuals are surviving further and further, and that is a thing to be celebrated. And our jobs as healthcare professionals is really to support these individuals through their multiple transitions from diagnosis to treatment to survivorship and beyond. The reality is, however, that it is a changing picture, and late effects we do know now we can predict and we can address them, but they are changing, and they're changing by virtue of many different things. The age of diagnosis, the nature and location of the tumor. There are, depending on the nature of the treatment, significant medical impact, neuropsychological or cognitive issues to consider, as well as the psychosocial experiences of individuals and their families as they move through the lifespan, and what that means for them in their job, which is learning how to learn and moving beyond into successful and fulfilling life. So the fact is, and we all know this, that there are multiple transitions. And while these arrows are certainly lined upon each other, one upon each other, the reality is that these transitions are not necessarily experienced at the same time for all survivors of pediatric brain tumors. There's certainly a lifespan of developmental transition from child to adult. And when and how a child moves through those different phases really depends on a multitude of issues, including the context in which they're being raised, the nature of their own developmental protective and risk factors, and reality of what those issues might be with respect to their brain tumor and experience. The healthcare transition, depending on where you work and live, can be a very abrupt one, from the pediatric to the adult healthcare setting. Even though we certainly had a number of polling questions at the beginning, one that I think is a useful one is the reality is that there are some settings in which individuals literally leave one door of their pediatric care and walk into another door that is the adult world. For others, however, they have the opportunity to be followed across their life within a broader singular institution, which really provides certain opportunities as well. But the fact is, for many individuals, the pediatric to adult transition can be quite a traumatic one, one which I think across different chronic health conditions we are trying to address in better ways, the more proactive nature. And then, of course, there's the whole idea of the secondary to the post-secondary transition, and whatever that post-secondary picture might look like, be it vocational, be it academic, or volunteerism in that area. But when and the time at which it happens can really depend on time missed at school due to treatment and late effects. It could be based on having to repeat grades or courses, or what we call in Ontario after grade 12. There are many, up to 35% actually, who do a victory lap, and that's not specific to brain tumor survivors. So it's not necessarily 18 or 17. It can be up to the age of 21, certainly. At least that within Ontario, many individuals are able to stay in school depending on the program in which they're enrolled up to the age of 21. So really each of these transitions really represents unique challenges and opportunities, but also stressors, not just for the survivor, but the team caring and working for that individual as well as the family. So let's talk a little bit more about the developmental transition and what the goals are of the transition through development. In fact, the transition from child to adulthood usually begins, well, I think there are many who might take exception, but we think about really kind of that middle childhood time through until the late 20s and even early 30s, depending on some of the issues that might be presented. And for pediatric brain tumor survivors, it certainly can take longer for them, and it may include some significant delays. And some of those goals of developmental transition are about trying to identify who you are, potentially relative to your family, but relative to your friends, your peers, and the other roles that you may have. It's about establishing and having really meaningful connections outside of your family. And for so many of the patients that we work with, their relationships outside the family can be somewhat limited or different from those of their peers, because so many of them can be with people that they spent more time with during their treatment, which can be a lot of the healthcare professionals that are part of their lives. Again, another goal is certainly about becoming more independent, becoming the individual that you are, and how to be that with respect to autonomy and developing that sense of self. And in developing your sense of self, you're looking ahead. You're looking about what you're going to do moving into that role of an adult. And that, of course, has a significant implication for academic and vocational training. So what are some of those developmental tasks of youth and young adulthood? Well, certainly John Rice, who's at University of Florida, they have a very, very strong and active research and policy advocacy group there that's really looked at trying to look at those transitions across development and across healthcare, and really looking at trying to build bridges so that we don't have these chasms, these drop-offs that seem to happen. And some of the things that he certainly has highlighted about, which I've kind of reflected on already, is about this idea of developing a healthy self-image and setting goals. Those goals will involve some degree of independence when it comes to finance and partnerships that are beyond peers, but also romantic, personal partnerships that may involve marriage, some type of companionship. And then once beyond the secondary school academic community, you're moving into another community, and the community that may involve your workplace, may involve your post-secondary institution, but also a community beyond that may include volunteerism and other aspects. So that's developmental transition. Let's think a little bit about what healthcare transition is. And while this is an old slide, I think it is a very important one because for a very long time people were talking about it, and then finally there were some position papers. People actually got together and started using the same language. I think that's been, I think, an issue with anything that people acknowledge as a problem or an issue, but until people come around the table with different perspectives to come up with a common language, nothing can really be achieved in an effective, sustainable way. So the Society for Adolescent Medicine, they came up with the definition, which they think of healthcare transition as a purposeful, planned movement of adolescents and young adults with chronic physical and medical conditions, and some of those may be invisible to others, from child-centered to adult-oriented healthcare. And I think that's a really nice way of framing transition with respect to healthcare. But I think transition is about movement, and it's about planning ahead for that movement, and that movement happens again across these different domains that I've highlighted already. What is the goal? Well, certainly it's one thing to be planful and purposeful, but what is the goal? It's about optimizing outcome. And what does that mean for an individual? It really is about maximizing lifelong potential through giving the provision of very high quality, but and I can't highlight this enough, developmentally appropriate care services that continue in an uninterrupted fashion. So I think these issues of developmentally appropriate, proactive, and uninterrupted care is one of the issues that we need to continue to think about as we move forward as healthcare professionals and families. So let's think a little bit about what the culture of care is. For a pediatric provider, really we think of ourselves, and certainly this is something that at the Hospital for Sick Children we take great pride in, the idea of family-centered care, not just treating the individual, but the family is a part of the experience. And we also look at it and as pediatric care providers, we try to think of considering all the issues that might be involved with respect to development, with respect to school and other things that are happening, providing some psychosocial support that is nurturing and supportive moving forward, interdisciplinary. For example, within our institution, we will have our clinics in which the family stays for the most part, unless there are certain tests to be done in other areas of the hospital, but with respect to care from an oncological, psychological perspective, nursing, everyone comes to the family within, rather than having to have them navigate throughout the hospital any more than they have to. So it's a really interdisciplinary, very collaborative, lots of pre-briefing, debriefing, etc. And there's parental direction and consent that is flexible, and that care is flexible across that setting. Now, the reality is that the adult setting isn't set up to be that way and isn't necessarily as efficient in providing care that happens within a pediatric setting. So you can see that it's much more individually based, and for those of you who are practicing, that it certainly is that way, and I look forward to hearing comments with respect to that. It tends to be more disease-focused versus developmentally focused. And also there's more of a fact-based, cognitive, I want to say didactic, but there is an aspect that is more cognitive rather than kind of multifamily, inclusively nurturing. And there's many disciplines, and many of the survivors that leave our aftercare clinic, our neuro-onc brain tumor aftercare clinic, when they move to their new adult setting, they may be going to as many as 4 different hospitals. So rather than being able to be in one hospital and perhaps moving within that or staying in one area, they are going one place for endocrine, another place for neurosurgery follow-up, another place for ophthalmology, and then another place for their actually oncological follow-up. So you can see how there's multiple disciplines all involved trying to provide optimal care for an individual, but it's different from what has happened for this individual within the pediatric setting. And of course, to be able to handle and to be able to navigate this particular culture of care within the adult setting, a patient really needs to be as independent as possible and autonomous. And while this information is currently from quotes with respect to coming of age with diabetes, I think it's very appropriate across a number of different chronic health conditions, of which brain tumors are certainly one. So for youth, there's a whole other set of skills that they need, not just to be autonomous and be able to function independently, but part of functioning independently means understanding what it is what your treatment is involved, what are the implications of your treatment, what are the things that you should know about making successful or positive choices for yourself in terms of with your peers, but also within a healthcare setting or on the sports field. How do you manage your own care? To what degree are you actually involved in making appointments, filling scripts, knowing how to plan your appointments and manage your appointments with respect to all the other things that are happening moving forward. So this knowledge of your own illness and treatment history and associated risks, the need for these skills for independent living, and the goal really with all of these pieces together is about obtaining much needed and essential medical care to minimize late effects and to monitor for outcome. But talking about that, it's talking the talk versus walking the walk. And I think while we talk about these issues, I don't think we've done very much or as much as we need to empower youth survivors with these kinds of skills. So to summarize, the healthcare transition really moves from more of a family focus to a more young adult or individually focused experience, where there's essentially parental decision making with child input, to individual autonomy and the need for competency to be able to participate in those decisions, as well as moving from a more kind of individualized experience to more of a standardized kind of treatment approach in follow-up. And those you can see potentially where cracks can happen for individuals who move from one setting to another, particularly when you're looking at multiple locations as well. So after I've said all of that, then why do we have survivors of pediatric brain tumors move to adult health care? It looks like we were doing just fine by them before. Why would we insist or kind of support them moving forward into an adult healthcare setting? What's in it for survivors? Well, the fact is there's some really important psychosocial benefits. Certainly transition, HCT, healthcare transition into adult healthcare settings, really it promotes normalizing social emotional development within the larger peer setting. It's a sense of that competence and that awareness of that competence. The opportunity to continue to hopefully build on what we think are certainly protective factors and engagement in healthcare and monitoring for a positive self-image and some self-reliance. And with all of those, to be able to be that individual who is that much more independent. It means an opportunity to be planning for your life goals. And also there's a system that's much broader of social supports, interpersonal supports, and other individuals who might have gone through similar experiences but may not have never had an opportunity to connect otherwise. So those are some of those psychosocial benefits. The health benefits, I think, are pretty self-evident, but it's worth mentioning. Certainly within the adult-oriented area, we're looking at primary and preventive care in a very different way than we do within, or are capable of doing necessarily within a pediatric setting. Having said that, we're certainly starting to do more of that. We're trying to cast the net a little bit wider in anticipation of that movement into adult care within some of the pediatric settings. But within those adult settings, really is opportunity for that screening and treatment of what are more considered adult health problems. And certainly issues around fertility are ones that we are talking more and more about, but really the specialists are within that healthcare in that adult setting. Issues of reproductive, excuse me, healthcare as well. And then there's that specialty care that can only be necessarily found within the adult setting. Really, it is that direct experience that those specialists have with chronic conditions in adults, which we would not necessarily have in the pediatric setting, that expertise that they bring. And also access to these inpatient services and the different subspecialists that exist. So there's certainly many health benefits in addition to psychosocial benefits. So what are the barriers? Hopefully I've sold you on the process and the need for that transition. The fact is people are aging and we've got all these survivors, which is so wonderful and so much for us as healthcare professionals to learn. However, what are the barriers? Why are people literally, for us in Toronto, not able to make it from one door on University Avenue across the street? It's an 11 or 13 second crosswalk time, and not able to make it across the street to make it to adult health care. We're losing, or have lost, between 25 and 30% of our survivors. They're not going to adult aftercare. Well, I think there are a few different reasons. Fact is, this whole idea of anticipating the healthcare transition is not one that we talk about with families very early. Certainly in the time that I've been at the Hospital for Sick Children, it's really in the last 5 to 6 years that we're starting to talk with families about transition when they are transitioning into our new clinic, so into aftercare. So they're coming from their active maintenance and into our aftercare clinic. We start to talk about, you're here, here's what we can provide, but we're going to be preparing you for that transition into the adult healthcare system. So we're trying to address this issue of limited awareness, lack of preparation. Again, trying to do that, more of that earlier, because if we're not preparing youth with that self-knowledge, self-management, self-advocacy skills that are so essential to be able to optimally navigate that adult healthcare system, well then, if you don't give them the tools, how are they going to use them? Certainly, children know when they start school that they're going to be ending school. They don't necessarily appreciate that when they're starting their medical journey, that they will be leaving that pediatric setting or moving beyond that pediatric team to somewhere else. So there's a lack of preparation, certainly. And some of the other barriers on the other side is, while there are those adult specialists and individuals who have expertise with respect to the exacerbations of chronic health conditions in adults or certain issues, they may at the same time also lack knowledge of the onset of chronic conditions that have begun in childhood. So it's a bit of a not hypocritical, but there can be a bit of a challenge because they have expertise within the adult world, but they don't necessarily know how that's going to play out if some of these things have begun within the pediatric setting. And the fact is, and what I was hoping to highlight with one of the earlier slides, was that that transition is often prompted by a certain age rather than preparedness or readiness. So really, it's also often age or behavior. It's the age of 18, for example, at the Hospital for Sick Children. Age of 18, you're going to be going over to the adult aftercare setting. Excuse me. But are they necessarily ready, or do they necessarily have the skills that they need to be successful there? So what I'd like to highlight now is, again, from the University of Florida group, which has done a lot of work. Jean Repetto is part of that group, as with John Rice. And they've done a lot of work looking at healthcare transition. But what they've decided is, rather than literally reinvent the wheel, but think about how do we overlap or kind of create some synergy between transitions that are actually already happening for these children and young adults. They're already moving from education beyond how do we overlap and inform and empower the individuals, but also their educators and their healthcare providers to be able to really move forward in the best way possible. So really they have merged the idea of education transition and healthcare transition. Part of the goal to do that is to decrease the duplication of costs and efforts, because if people are doing it in 2 different rooms for the same person for 2 different situations, that's not very cost effective. Another way of doing it, another reason for doing our justification is really to increase the empowerment of teens and families as they experience the process of becoming adults in a unified process. So not just thinking about academically moving forward, but also thinking from a healthcare perspective of moving forward. And also it's about kind of supporting the collaboration between the health and education professionals, and hopefully also increasing creativity of some problem solving by bringing these groups together in a proactive way rather than waiting for the fires or for the crises to happen. So ideally, and certainly there's some building research to demonstrate that this merger of education transition with healthcare transition can lead to improved outcomes for youth and young adults with chronic illnesses. So as you look at it, you can see it's similar to other conceptual models of transition. Really, I think the difference lies in this idea of the maintenance of health for positive adult outcomes being the central focus of this model. The focus really is intended to support the outcome of post-secondary education, community, family, employment found in other models, but by ensuring that they become successful in each of these areas or with a focus on each of those areas. So it's a nice way of thinking about this model as being more of an overlay model rather than extending current practices. It's really taking advantages of what's working across these different areas of practice. So, whoa, my apologies. So what does this model really mean? So one of the first parts of thinking about it as a component is this idea of the advocacy. And I've talked about how the self-determination, the self-management, families not necessarily being ready for the transition are issues that we need to be working on at a very early point. So this is really an opportunity for educators and healthcare professionals to be working with their students, working with their patients, and to teach them how to advocate for appropriate healthcare, for accommodations. For example, in my own practice, my own clinical practice, I no longer wait till a certain age to include students in interviews. If a student is able to come to me and is already in aftercare, then I'm going to be doing an individual interview with them. And ideally, because they're the experts in what they're experiencing, they are the experts on what's working and what's not working, because the reality is school's their job. And while they don't want to be defined by their brain tumor or their medical experience, it does inform who they are and what they're able to and what's a bit more challenging for them to do. So to not involve them in this planning process, one, is a disservice to them. Two, it gives them the sense that what they have to say isn't valuable, that we're still listening only to parents potentially, or only listening to teachers, because at the end of the day, they're the hub and we're the spokes in that wheel, and we really want to be able to support them as much as possible. Similarly, I encourage kids and teens to be part of their academic meetings with their teacher, with their special education resource teacher, IPRCs, as much as possible, to have them tell me what their individual education plan, what's working, what's not, those kinds of things. So I think advocacy for all of us, regardless of your discipline, medicine, nursing, OT, PT, rehab, psychosocial kind of support, there's something we could be doing with advocacy from the very first moment we meet a child. Instruction. Again, it fits into all of these ideas of student involvement, social skills, daily living, self-determination. It's about learning how to do some of the things that your parents have been doing. It's about learning how to make these appointments to fill those scripts, how to communicate with your teachers, your principals, your co-op supervisors, your doctor, going in and saying, this is, you know what, I'm not feeling good about this, or can I play football now? Am I allowed to play football? Why am I not allowed to play football? Ask the questions and answer them in a developmentally appropriate way. The next part of this model, which again is an overlap, kind of an overlay model, is about this collaboration. So while the patient, the young person, is the center, and we're working to optimize their outcome and their transition opportunities, we really need to be also not just expecting them to take a role, but also for us to be communicating and collaborating across agencies, across disciplines, across silos, if it comes to that. Because really, when it comes to planning for academic outcome and health outcome, ideally we can inform what the educators, and the educators can also inform us. And at the end of the day, that all comes to be the benefit, and the family, the benefit of the individual. So it's about collaborating and moving forward and demonstrating efficacy. I mean, some of this seems self-evident, but the fact is we often don't do some of the things like planning, like thinking about transition at the point of entry. And that means thinking about health assessment, screening that can happen at every clinic visit, student kind of focused and youth focused planning as we move forward. And certainly within Ontario, every individual education plan has one section that involves transition and planning for post-secondary, or preparation and activities that will be embarked upon in order to plan for post-secondary. The fact is that we need to take health needs into account as well. And they also, that ideally, should know what kinds of things we're doing within our clinics to empower and plan and support the individual as they move forward. And we need to stop for a moment. And I know it's hard within our busy clinic schedules and when there's so many different kinds of requirements that have to be fulfilled. But we have to think about what are the healthcare transition goals and how are we defining successful outcome. For some, it might be just as easy as they showed up for their first 2 aftercare appointments within the adult setting. For some, it might mean they're filling their scripts, or they're making an appointment. They're able to report on how they felt with their thyroid medication for the last 3 months. But we need to think about how program is evaluated. How is outcome really evaluated? So we talked already before about what are some barriers to healthcare transition, but here are also some ideas around some solutions. Confidentiality, certainly that can be an issue, especially with that movement into the adult care setting. All of a sudden, the adult healthcare setting is calling, the parent answers the phone, they're unable, the healthcare professionals are unable to speak because they need to speak with the young person. Understanding the rules and the procedures that allow for sharing of information within family, across healthcare professionals, building on that and understanding and empowering individuals about what does confidential mean early on, and what can we do between disciplines and between settings and buildings and institutions to be able to promote an appreciation of confidentiality and respect for it, but also procedures that can allow us to share effectively. Talked about it before. For a very long time, healthcare transition meant different things to different people, or just the idea of transition. Across, I mean, I know even within our own team, there are times when we are asking, so what does that acronym? I know in my world, this MID means, for me, mild intellectual disability. In another world, it means, medical world, it means very different things. So it's about coming up with common terminology, common vernacular and vocabulary. And the way of doing that certainly is, I think, like what we're doing right now. So the opportunity that the Brain Tumor Foundation of Canada allows for a cross-disciplinary conversation and workshops and websites and providing information. How do we address this issue of the lack of understanding and knowledge about healthcare transition? Again, education, being proactive, the idea of online courses, about really dissemination of information across, and I think this is very important, across not just brain tumor and the oncology disciplines, but across the chronic healthcare areas. Because many people, you'll see I have information here from diabetes, I have information here from some other areas as well. We don't need to reinvent the wheel. And certainly now a lot of pediatric settings actually have their own unique transition programs. I encourage you to take a look, if you can, go to the sickkids.ca website. We have something called Good to Go. And it's actually an in-house consultation team that really is about promoting transition into the adult healthcare setting, and really will work with individual programs, be it cardiology, be it CF, be it oncology, to really put customized procedures and information in place that is accessible and useful to survivors, to the patients, as well as to the individuals, to the healthcare teams involved. This idea of the perception of why, so what about it? Like, what's the importance of healthcare transition? I think, again, it's about that, talking about it early. They know they're going to be transitioning from academics. We need to start talking about how you're going to be moving, you're going to be graduating from the pediatric setting. Again, this idea of developing teaching modules, it seems like it could feel like a lot of work, but the fact is there's so much out there, and I certainly, if anyone's interested, I'm happy to provide a list of some resources that are available that allow for the teaching and some transition goals and program guidelines that are out there. But I can talk all I want about this, but the fact is there time to do it? Well, I think the fact is that there's time to do a lot of things, but if we want to ideally empower survivors to move into adulthood and to fulfill their potential, however that is defined, then we have to start making time and incorporating it early into our daily care provision. Now then, there's the whole idea about letting go. What does that mean? It's about starting as a healthcare provider to start setting examples, of what is healthcare transition, or what is it that, in the next 4 years, what's going to be different for you? What is it that you want to start being able to do when you come here to the hospital? Do you want to come in and tell me what's happening by yourself? Okay, so, and then really starting to talk about, are you going to start, giving yourself your own meds? Are you in control of what medications you take when? There's reasons to be talking about what the health condition, or our situation here, talking about brain tumors, what those possible late effects might be in a developmentally appropriate way. I have to tell a quick anecdote here about a family that we've been trying to work with, and there's been a lot of no-show cancellations of appointments or no-shows. And then finally, with some perseverance and certainly some support from our overall team, excuse me, family came in for a neuropsych assessment. And it was during a conversation with the dad that, even though I'd already asked the young man about, he was middle school age, I asked him about, he takes his growth hormone, and dad jumped in and said, yes, it's to make him strong. I kind of had a hint that there might be a little bit more to the no-shows, the canceled appointments, than what had met the eye. And so when I was speaking with the father later, he informed me that his son does not know that he had a brain tumor, and was starting to ask some questions. And we started to work through that, and it started to explain some of the previous behavior, but also the issues of trust and information and empowerment, and the idea of what is the health condition, what is having a brain tumor, and the fact is this young man's doing really, really well. So the idea of talking and teaching about late effects doesn't just apply to the survivor, but it applies to the family, and how to support them, to help them move through what was a very traumatic family-altering experience, to then put them in a place where they can be supporting their child moving forward. Because right now, for example, the example that I just provided, that's going to be very tricky, and it's going to be a process. So I think that the idea of answering those questions in very developmentally appropriate manners, and also considering the cognitive level of the individual, is going to be really important. I think that's something we need to do more of, and certainly something that we do within our clinic. We make a priority with everyone who comes through. And again, this idea of moving from assent to consent with respect to the youth, and moving with that family-centered care, but starting to move before they move into the adult health care setting, into having them providing that consent and determining their appreciation of the implications of consent, of whatever procedure that might be. For family, changing that decision-making role and starting to shift that over to the youth, to the child and youth, and that whole idea of in a developmentally appropriate manner, and even for those who are more neurocognitively affected or challenged, there's still some decision-making that can be made on certain domains. Some of the bigger decision-making may still very much remain with the family, but whenever possible, really trying to shift that while still within the pediatric setting, shifting that decision-making role and to do it in a safe way. For the youth and the young adult, really it's about starting to take on those roles, talk about what those roles are. They want to be separate, they want to be, but when they come back into the hospital, they're often dependent. They're often kind of rely on that role that they had when they were much younger. So what are some really key skills? I've talked about this before, but literally, what is an individual who's in the midst of healthcare transition, a survivor of pediatric brain tumor, what do they need to know? Like, what are the must-haves as they move forward? Certainly, if there are some urgent medical issues that are associated, like, shunt blockage, how would they know if they're having a shunt blockage? What's their understanding of that? What are signs and symptoms that would require seeking out an ER, for example? What are some of the possible late effects? Secondary malignancies. What's the impact on fertility, sexuality, reproductive health? Knowing about the condition and where can you get information. You may not have to memorize it all. You might have a passport to health. You might have some kind of summary information, but you really need to know where you can get that information and what are the roles of the people that you're working with that are caring for you and will care for you moving forward. And again, to go with the idea of what are and where and how can I access emergency health services, and what is the promotion of healthy behavior and health behaviors in general. So I'm going to just talk a little bit with respect to the healthcare transition, just talk very briefly about post-secondary education. Really, you're going to see there's some very, very heavy overlap with some of the aspects that we're talking about with respect to the goals of development, the goals of healthcare transition. It's about, again, self-advocacy, figuring out your path. You're going to have to start to do things more on your own. Less feedback, there's less structure within some settings, and you might have less contact with your educators and have to have less time in class. That applies as well to the adult healthcare system. You may have less contact with your physician. You may have less time that you spend overall. In the workplace, now there's a whole new set of expectations. There's an etiquette. You need to be able to know what your requirements are, achieve them, be able to advocate for yourself, find out what your interests are. And at the best of times, figuring out what you want to do when you grow up is not easy. And figure out how you deal with the dynamics that exist, and also issues of insurance and seeking out additional information as it pertains to your healthcare condition. So some of you may have heard about SAFIT. It's now been around for a while, but it's a project affiliated with, housed under the Pediatric Oncology Group of Ontario. And I have to tell you that the Successful Academic and Vocational Transition Initiative was supposed to be a temporary name. It has stuck. It is a mouthful, but really SAFIT is an effort to really cross what we call the silos, to cross the healthcare. It's kind of like the overlay model of the EHCT model. It's cutting across healthcare, education, pediatric to adult, and really looking at sustaining and supporting an individual as they move into the vocational employment and social assistance sectors. And here we have all the individuals who were involved in the initiative. Excuse me. Those who are eligible really are anyone who has been treated with for a CNS-related disease in terms of either leukemia or lymphoma, brain tumors, other cancers as well. So it doesn't necessarily have to be limited to CNS-directed, but we have certainly the bulk of the individuals who are involved within SAFIT fall into this group. They are students who are in grades 10 through 12. They might just be trying to figure out what they want to do, and how does that fit with what they're able to do. So, for example, a teen who's had craniospinal radiation and has a very, very a slow processing speed might not be the best fit or be very successful within what is a very traditional kind of high school job like retail or multitasking at a coffee shop or working at a fast food place, because they have to work efficiently, multitask, be responsive to many different types of stimulus. That would not be a good situation. So it's about setting and identifying career goals that match with their interests, of course, but also with their strengths and challenges with respect to cognitive outcome. As well, what's great about SAFIT is it really, for us, does, those counselors really are the bridge. They may meet their clients or our patients in the pediatric setting, but they are with them through into the adult setting. So they can continue to work with those individuals as young adults or older who want to either switch post-secondary or looking for employment. The way I describe SAFIT counselors are as really being kind of specialized guidance counselors who get it, who get what it's like to have had cancer or like a brain tumor, be it a cancer, a malignant or non-malignant one. And again, they're also available to adults and young adults who are undereducated or underemployed or don't know how to access the academic system. They counsel in a very individualized way. They're able to kind of explore, kind of hold the hand as much or as little as needed in terms of exploring kind of interests, developing a plan, be it for education or vocation, help with the applications to college or work creating their resumes, and sometimes even kind of doing mock interviews, what it would be like, linking with services within the social, but more importantly, educational system, and then helping them with strategies for being successful and focusing again on strengths and skills rather than on deficits, while at the same time acknowledging what those deficits might be. So what I hope I've done in the last 45 minutes is really talk about those areas of transition around healthcare, our goals being really continued promotion of healthcare behaviors, monitoring and preventative care, as well as the need for specialized care that happens within for certain individuals in the adult setting. The idea that there's transition that happens from school to work, be it education or vocational readiness. And then there's this whole issue, which I think certainly warrants a lot more conversation, is really, especially for those who are more profoundly affected, around moving beyond the family. Well, parents might not be there for some of the more profoundly affected survivors once those survivors are into their 20s and 30s or older. And so what do we do, and how proactive are we in terms of addressing issues of adaptive living and access to housing? And certainly in Ontario it's a massive issue. And it's a conversation we have every month and trying to find supports around addressing with respect to housing, but also thinking about those skills that are so necessary in terms of self-care and appreciation of money and other aspects. So I guess what I'm hoping is that now that we've moved through this webinar together, that there's an appreciation that this developmental transition that is ongoing, ideally we move to degrees of autonomy and independence for the individual and supporting the brain tumor survivor, so that with that autonomy and independence, and as that continues, they will have more skill and be more independent navigating both the healthcare system as well as the post-secondary workplace, but appreciating that this is an iterative process that continues at different ages and in different stages as they move through their development. Want to highlight on behalf of Brain Tumor Foundation of Canada that there's some Information Day conferences coming up. Calgary, you've got a couple days, and there's also in Saskatoon, there's coming up on October 4th, and on the 19th there is the Information Day. Thank you for your time, and happy to answer any questions you might have.
Thank you so much, Dr. Guger. That was very well presented, and we had lots of people online with us today. Lots of great information that you've provided, lots of great tips and suggestions for those transition times for our pediatric population. It looks like we just have one question. It was just in regards to the resources that you were referring to, the educational-based transitional resources. And just a couple people were wondering if we could maybe email them to them. And
absolutely. I'm sorry to interrupt, but I'm happy to put together a list and send that through, both the ones certainly that are in-house at SICK, but incredibly valuable ones that are available to the University of Florida, and a lot of other fabulous resources across North America and Europe. So I'll pull together a list for you.
Perfect. You can just send that to me, and then I can send it out to everybody who signed on, and also to those people who weren't able to sign on. And just a reminder to everybody that Dr. Guger's presentation will be up on our website next week sometime, early next week. And everybody will be receiving a SurveyMonkey through their email, so if you could please take the time to complete that for us. And also a reminder that October is Brain Tumor Awareness Month. We have lots going on across the country and on our website, so we encourage everybody to go to our website at www.braintumor.ca to check that out. And once again, a big thank you to you, Dr. Guger, for taking the time to giving this great presentation for us.
Oh, my pleasure. Thanks for the opportunity.
Great. Thanks, everybody. Take care. Goodbye.